Hello all. Today we shall discuss about hair transplant. So hair transplant is a surgical method of restoration of hair. So we transfer or relocate the hair from one region of the scalp to another. And mostly it is from the occipital area, that's the backside of the scalp. This is because this region is highly resistant to baldness. It's a DHT receptor resistant area. Now, the latest technique of hair transplant is a follicular unit extraction. And there's a high demand for hair transplant now because of increase in awareness, change in lifestyle, change in attitude, because of the media hype, and they're all looking for a hustle-free cosmetic correction. Now, once you go to a dermatosurgeon or a plastic surgeon for hair transplant, we need to first identify if you're an ideal candidate. Now, the hair transplant surgery is mostly done in an androgenic alopecia case, female pattern alopecia, and a burnt out scarring alopecia. So we first need to know what is the cause of the hair loss. What is the underlying cause of hair loss? If it is an androgenic alopecia, we see what type you are. So ideally a type 3 to 5. You are a good candidate for hair transplant. Now if you are a type 6 or a type 7, then you will need multiple sessions. Also depends on your donor area capacity. Now, those patients who are contraindicated, if the patient has an active infection, or the patient is an active scarring alopecia patient, or the patient is less than 25 years. Ideally, we don't do hair transplant for someone less than 25 years because we want to see how it is progressing. Now, there is a difference here. Now, if the patient's young age is important for his profession, like he's in an entertainment industry or he's a model, then even less than 25 years can be considered for hair transplant in this case. Ideally, we wait. Now, those patients who has unexpected, unrealistic expectations, and the patient who has some psychological issue also to be considered is relatively contraindicated for hair transplant. So once you visit the doctor, he's going to analyze you. We take the complete detailed history and then he's going to analyze you with a tricho scan. We need to know how good your donor area is, what is your donor area capacity. So donor area ideally is the area that is from the tip of your ears to 4 centimeter above in a semicircular fashion, connecting the same dots on the either side. So this is your donor area. So we first calculate the area available and then we see how many follicles are present per centimeter square. Now we also want to see whether you have multiple follicles or single follicles or more. And then we look into the caliber of the follicular unit. If the thickness is more than 70 microns, then there's a good coverage for you in the hair transplant surgery. Or is it going to be thin hair? Then again, that has to be discussed with the patient. Then the color of your follicular unit. So this is first analyzed, and when we see that you have an adequate density, donor density, then we look into the area that is required for hair transplant and we calculate the area. Basically, we divide it into frontal, mid scalp, and then crown area, and we calculate the area required. And ideally, we are looking at somewhere around 35 to 45 follicular units per centimeter square is the coverage we are looking at. Now, in one sitting, we only take around 25% to 30%. And over a lifetime, a patient can take at least up to 50 to 60% of the donor area can be taken in multiple sessions in his lifetime. So once your ideal candidate and once all this is calculated, you do a blood investigation and an ECG or a TMT is done to know your cardiac status, and then pre-operative instructions will be given on what vitamins has to be stopped, when it has to be stopped, what medication has to be stopped. And the procedure is done under local anesthesia, so we do a test dose of the anesthesia to rule out any allergy, and you will be aware and conscious and relieved of pain during the procedure. Now, post-op procedure, again, there is certain set of instructions that you need to follow with. The grafts have to be kept wet in the first few days. Every couple of hours, it needs to be well hydrated. Yes, those instructions will be given, and from when the other spray and lotions has to be started will also be given to you. Now, most of the patient who is a hair transplant candidate will also require medicine, because mostly we are doing the hair transplant on the or gap filling in between the existing hair. So, if the patient takes medicine, then he's going to have a better coverage and better density over a year's time. So, you can discuss whether you are a right candidate for hair transplant today. Visit us in the clinic. Thank you.